One of the first things people typically want to know when they're diagnosed with a medical condition is there a cure for this? When it comes to traumatic brain injury, let's find out what Dr. Ned has to say about if there's a cure.
Well, thank you, Ellie. So the word cure in the medical sense is when we take a substance or procedure or some sort of lifestyle change or even a philosophical mindset. We apply that and we eradicate or eliminate this disease,
Right.
a disease. So we think about a medication, we think of a surgical procedure or psychological mindset, and once we apply those, the disease should go away. Well, for brain injury, it's a little different. So now if you compare it to, say, like cancer, that you give a drug or radiation and the cancer goes away, that's one way of thinking. But for brain injury, we have to look at the recovery from brain injury or the treatment of brain injury as organizing something that's disorganized, a complex system. Now, you start from this whole concept of, are you the same as you were yesterday? As we know that we change every day, our brains change every day. And so when we think of a cure, you think of the state that you were previous and going back to that state. So cure in that sense doesn't really work with brain injury like it does with some of the disease, because you're not going back to that state that you were yesterday. We try to get there as close as we can, but we're not really getting back to that state we were originally with.
What is the issue with thinking of a cure, I guess, for a TBI? What does that cause for the individual or for the family, the friends, everyone going through it with them even?
Well, first, it kind of creates a sort of unrealistic expectation. It's like, I want to be this way, and I want to be this way
I want to
now.
go back to how I was before everything.
Exactly. And that's part of the driving force with recovery from brain injury. And it affects everyone. It affects the treating, the physicians, the therapists, the patients, their family, because we want to go back to school. We want to go back to work. We want to go back to studying. We want to do the things that we did before. We want to go to a mall and shop.
Make us feel like ourselves.
Exactly.
Yeah.
We want to feel whole instantly. And so what does that do to us when we have this sense of urgency? It creates this kind of unrealistic expectation. And we've gathered that type of unrealistic expectation from the medical model of cure and recovery. And so in brain injury, we have to look at it slightly different, slightly differently. So how?
Like, what exactly does this sense of urgency do to the person?
Well, first, it creates a sense of anxiety because all of a sudden you realize that you're not in control of yourself, or you're not in control of the environment. And so that creates a sense of urgency. And that sense of urgency leads us to make decisions for ourselves that might not be helpful.
Right.
Or it leads others to make decisions for us that might not be helpful.
So this sense of urgency basically, instead of bringing you forward, just keeps you back.
It can.
Yeah.
Sometimes it's good because it helps you propel yourself and motivate you to move forward. But equally, it could literally retard your recovery.
Right.
And that's one of the issues that we must address in the recovery process from persons with brain injury, is how do you strike that balance between, say, going back to work versus not going back to work?
So what do you focus on?
So you focus on when do you stimulate or when you slow down. There are times after a brain injury where we need to slow things down, and there are times we need to speed things up. The balance that we need to strike is going forward or increasing the stimulation making us better or making us worse? Or is slowing things down making us better or making us worse? So the idea is understanding how prepared the body, the environment, the patient is to stimulate or to inhibit. And that's the crux of treating patients with brain injury. When to do what and to what extent.
Got you. So
It's a balance.
it's a balance.
It is a balance. So take, for example, to use a medication or not to use a medication. Some medications will stimulate, but if you stimulate a patient at the inappropriate time, you can make them worse.
Right.
I give an example of this in my book, where a patient was given a stimulating drug to wake them up, when that drug caused that patient to have a worse outcome. They elevated their blood pressure, elevated their body temperature, and actually things got worse. The body actually started reacting in ways that was negative. And these learned behaviors of negativity actually retards recovery. So knowing when to apply a drug, when not to apply it, knowing when to apply a therapeutic modalities, when not to do it, these are some important principles that must be incorporated in the treatment of persons with traumatic brain injury.
So I would say the takeaway is not to think of TBI in forms of curing yourself, kind
Yes.
of, and to just focus on recovering in balance and making yourself live life to the fullest.
Absolutely. I couldn't have said it a better way. It is about balance.
Yeah.
That's the essence of treatment of persons with traumatic brain injury or brain injury in general.
Well, awesome. Thank you, Dr. Nunn, and thanks everybody.